Hi, support Fibro friends. Good morning from California. I did not have good sleep last night, so I'm going to need extra coffee for this. Got my Team Frida cup. Shout out to Dr. Lipton here. But I decided to do these Sunday lives to kind of literally go through the information that's out there and share with you. So please definitely note that you can join in, you can follow along, and that's the point. And this is an open discussion, so please post your comments. And definitely don't forget to share our content, like our pages, subscribe to our information. We really appreciate it. We're a patient-led nonprofit organization that's geared towards education, research, and advocacy for the fibromyalgia community and moving it forward. So that's why we're doing these videos. And I decided on Sunday, I'm getting started. I'm more familiar with using our new fibromyalgia broadcast system and doing screen shares, but we're going to give this a try and see how it goes this morning. Again, forgive me. I need lots of coffee because I did not sleep well. Oh, good morning, Pamela. I hope you enjoy this conversation. We're going to go look through all the medical sites this morning. So I decided to do a conversation on what is fibromyalgia and our online search for answers. Many of you have probably put in what is fibromyalgia in a Google search and seen what's come up. And I'm going to take a look at some of those. I realized when I kept doing the search that new stuff kept popping up. And it might take a long time to go through everything that pops up in the information. I also didn't want to call out certain things because this is to give you the types of information that are actually coming up for people when they do a search. If you're newly diagnosed, if you're a caregiver, or even if you're a doctor looking for research on like what is fibromyalgia, this is some of the information that is coming up for you. It is different across the board. So that's why I want to bring this up. And I know we've just completed or almost completed Fibromyalgia Awareness Month, and you've seen a ton of information on social media, and we just need to figure out what's going on and why is there such a disconnect between our providers as well as the community. And I think it's good for us to be on the same page as much as possible, but how can we do that when a lot of our government websites and the medical websites that we refer to have different information? And I mean, by different information, I definitely am referring to different language of different definitions, but you'll see the differences as I go along. And I'm going to start by screen sharing a lot of it. And you can definitely log onto your computer or phone and read along with me, but I'm going to put links to each of the sites so you can always reference them. And again, these all come up on the first page if you type in fibromyalgia or what is fibromyalgia. And we're going to go through some of the language and kind of come and have a discussion about it. How can we improve this? How can we get the correct information out there, especially to our providers? Because this is you'll see how confusing it really is when you go from medical website to medical website. So let's get started with the American College of Rheumatology. I'm gonna do a screen share here. So I pulled up the website, and here is the link if you'd like to follow along. So I posted this link, and you can always save this as a reference too. So for many, many years, we have told fibromyalgia patients to go see a rheumatologist. And I wanted to share what the American College of Rheumatology says about fibromyalgia and their definition. And I do think rheumatologists are a good place to start to rule out or diagnose other conditions as well, because we know and we've heard from our lupus friends and other conditions this month, and I'll just name them, like EDS, Lyme disease, which is very complicated to get a diagnosis for, that these are things that need to be addressed and looked at. It is our Arthritis Awareness Month, so that's another thing to take a look at. So all of these have very similar symptoms, underlying thyroid conditions. So who do you go to get a proper diagnosis? So rheumatologists are a good place to rule out some of the other conditions that may be coming up. But again, it's not conclusive, because you may end up being like myself, who has been given a fibromyalgia diagnosis since the age of 14, but at the age of 30, other symptoms started to come up with joint pain and those things. Nothing showed in my x-rays, but apparently I'm in between autoimmune diseases, which it takes a long time for a lot of people to get a final diagnosis of an autoimmune disease, because symptoms can start, and I know there's phases for autoimmune conditions. I've heard experts talk about this. So it's very confusing. So what does the information online tell us about this? So from the American College of Rheumatology. You can find this, and they have fibromyalgia listed. They've started with the fast facts, and I'm going to do a full screen share for you so you can read along with me. Fibromyalgia affects 2 to 4% of people, women more often than men. Hopefully one day I want to change that language because I don't understand why we always have to point that out. I get it, but I think we should copy some of the languages used from other conditions, because there are other conditions like lupus and Alzheimer's where it does affect more women, but the language they use is much more favorable to be more inclusive. Fibromyalgia is not an autoimmune or inflammation-based illness. And again, I'm going to try to avoid giving my opinions, but if you hear me kind of chuckle, there may be just some discrepancy on this later on with some of the newer research that's showing. Oh, and before I forget, I'm going to scroll down to the bottom and just show you that this information has been updated March 2019. You're going to see some of the other government websites, and they have not been updated for a while, just to let you know. So I always tell people to just scroll down to the bottom and make sure to check when this content was last updated. Okay, so doctors diagnose fibromyalgia based on all the patient's relevant symptoms, what you feel, no longer just on the number of tender places during examination. Those are new and updated information. There is no test to detect this disease, but you may need lab tests or x-rays to rule out other health problems. So this is a big statement, and I wish that they didn't say may, but it's definitely important to look at other conditions as well, because there is now a lot of overlap. Yes, of course, we've heard this before. Patients can feel better with proper self-care, such as exercise and getting enough sleep. There is no cure. Medications can reduce symptoms in some patients. Fibromyalgia is a common neurologic health problem that causes widespread pain and tenderness, sensitivity to touch. So this neurologic language is something that's new for the American College of Rheumatology. And then they go through its long-term illness, and we talk about things that this is usually common on all the websites. And it often starts in middle adulthood, but I'm glad they added this. It can occur in teen years and in old age. The interesting part here is you are at higher risk for fibromyalgia if you have a rheumatic disease. So this is something that's new, and they list others. So we've heard from other people that have been diagnosed with some of the arthritis conditions and even lupus, and then they also have a diagnosis of fibromyalgia. Of course, they go through all of this. It's neurologic, chronic health condition. So that's something new that's been added, and some of these patients may also have additional symptoms, which we are all familiar with, and this is pretty consistent across most websites. What causes? Okay, so the causes are unclear. So this is true. We're still unclear of what causes fibromyalgia, and I'm glad that they say it may be different in different people. Current research suggests involvement of the nervous system, particularly the central nervous system. So these are good points if you're sharing information with your providers or other people around the internet. They still state that fibromyalgia is not from an autoimmune inflammation, joint, or muscle disorder. So they bolded this, so they really mean it. Fibromyalgia may run in families. So this is the new information that has come out. And they talk about triggering factors. So other things like structural issues, emotional stress. I like how they added levels of brain chemicals and proteins may change. So that's an interesting thing, again, from more of a brain science perspective. They talk about the central pain amplification disorder, but again, it's very loose language because we do need better research and we do need to understand what's going on. So I don't know, with this statement, it's medically benign. So I think what they've noticed, it doesn't cause this, but there's a lot of overlapping conditions. So it's really difficult to kind of make these statements, and it's very loose. The diagnosis, I really encourage people to take a look at this new information on fibromyalgia and how it's diagnosed. So, because you really want to look at other conditions too when you're going to see a rheumatologist, and they'll definitely do that. And they'll do the tender points test, but that's all been updated. And it's kind of, again, this is really loose language for people. So it's hard when doctors are looking at this information to kind of adjust to see, because it's like blood tests can tell you if you have either of these problems. So I'm glad they've added it in as like mimickers. So they put hypothyroidism in here and other rheumatic conditions. So it is important for your doctors, or if you're working with a primary care physician and they want to do this, it's like, yes, run the other blood test just to see what else is going on. It's important. So make sure your provider is doing that for you. They have updated the criteria. So this is from their source of 2010. So they have added that, and they've added other things like no other health problems could explain the pain and other symptoms. So, and this information changes as you go across the internet. There's been information that have been trying to get updated, and some providers talk about the new updates, but it's really not official with something like the American College of Rheumatology. So this can get confusing when you're looking at other information on the internet. The treatments, I think we're familiar with how confusing this is. They have switched the non-drug therapies to the front, and they're using things like CBT, alternative methods. So they're acknowledging some of this can be added to your treatment in case your providers are a little skeptical. So they are doing what they can to get more information out there. And there is information on medications there, and they do talk about sleep problems, living with fibromyalgia. Ooh, sorry about that. So they'll give some information here. I know it's tough. We all struggle with sleep. Like I mentioned, I had a rough night. Relaxation, exercise, which I won't touch right now because I have, a battle with exercise myself. And they're listing some other references. The additional role of a rheumatologist. Now, I want to highlight this because it's an important point. Fibromyalgia is not a form of arthritis joint disease. It does not cause inflammation or damage to the joints, muscles, or any other tissues. However, because fibromyalgia can cause chronic pain and fatigue similar to arthritis, some people may advise you to see a rheumatologist. As a result, often a rheumatologist detects the disease and rules out rheumatic diseases. But for long-term care, you do not need to follow with a rheumatologist. Your primary care physician can provide all the other care and treatment of fibromyalgia that you need. This is definitely something to point out to everyone, and probably why that there's a struggle here when you go to a rheumatologist, what's happening. So they can give you the diagnosis, but we're having a breakdown in the healthcare system for fibromyalgia because people are approaching rheumatologists with an existing fibromyalgia diagnosis, and they're wondering why they get turned away. So this statement can be very relevant to that because it looks like they're deferring to primary care physicians to manage your treatment protocol. Now, one thing we want to do we are putting together at Support Fibro is the ECHO model, and we're really targeting primary care physicians for this very point on managing the care of our fibromyalgia community here. Because some of the university hospitals, I've heard, if you approach them with an existing diagnosis of fibromyalgia, they won't accept you, and they're deferring to other providers. Now, there's a ton of other providers out there besides MDs. I know naturopathic doctors and different providers will take this on, so that is good news. Of course, that is a different issue if it's covered by your insurance or not. But this is an important point to note on the American College of Rheumatology of what they're specifically saying. So if you're not sure of your diagnosis and you need to look at other conditions, like the rheumatologist is a good place to go. But after that too, we've seen people who get a diagnosis and the rheumatologist let them know that they no longer can provide adequate treatment for them, because treatments are difficult with fibromyalgia. The stuff that rheumatologists generally use for autoimmune conditions and arthritis conditions don't work all the time for fibromyalgia. It's a very confusing battle. So I think this language is, and this is new because this caught my attention last year as we were doing more research to go to Capitol Hill. And I was like, okay, this is starting to make sense right now, but we have then a gap. If this says your primary care physician can provide all the other care and treatment of fibromyalgia you need, we have a gap right there because they're deferring to primary care physicians who we know for many, many years have not been educated, have not been provided the medical education on fibromyalgia. We've always focused continuing medical education on rheumatologists. So this is an interesting thing to take away. And of course, there's pain medicine doctors, and I would love to have experts and other people come on, or if you yourself has done a lot of research, I would love to hear from you and post your comments and send your messages in, because if you've already done this research and research for any of the other topics that we're going to cover in these Sunday lives, please send me a message. And who knows, if you are interested, you can jump on here and talk about the research that you have done, because it's important we get accurate information out there to our community. So that's the American College of Rheumatology information. And I'm going to remove this from the stream, and I'm going to go to the lovely CDC and add that in for you too. I'm getting used to all this like screen share stuff, so bear with me as we transition. So next up, we're going to talk about the CDC. And I'll definitely, what's interesting here is the CDC, so the Centers for Disease Control and Prevention, lists us under the arthritis category. Yes, I will. Pamela, I can definitely send you all the links to this information. And I've just shared the CDC information, so if you want to follow along, you can. So we're listed under the arthritis program for the CDC. So this was fun, actually, and I mean that sarcastically, trying to explain to our reps when we went to Capitol Hill what is going on and the confusion of it. So let's take a look at some of the language from the CDC's website. Okay, so what is fibromyalgia? Fibromyalgia is a condition that causes pain all over the body and also referred to as widespread pain. You'll have sleep problems, fatigue, often emotional and mental distress. Fibromyalgia may be more sensitive to pain than people without. Okay, so again, like I said, this is consistent information across the board. Abnormal pain perception processing. Fibromyalgia affects about 4 million US adults, 2% of the adult population. The cause of fibromyalgia is not known, but it can be effectively treated and managed. Again, I'm not gonna try to give some opinions here as much as possible, even though you may hear it in my voice as I chuckle under that. But these numbers are important to understand because there's a lot of information on different statistics, and I think I'll save that for another video to get into at another point in time, because I think some of the information came from a different study which got 6%, and I finally found out how they got that. And then these government websites have different information, and we're just trying to get consistent information. I did want to note that this page was last reviewed, it says, on October 11th, 2017. So this page could use an update for sure. What are the signs and symptoms? So it goes through some of the signs and symptoms of what we're looking for, so you can take a look at that. What are the risk factors for fibromyalgia? I do like the additions of lupus or rheumatoid arthritis, so that's good to note for all of our friends in those communities. Some other factors have been weakly associated, so they're kind of breaking down some of this. Again, this definitely needs an update. They take medical head examinations, x-rays. How is it treated? They'll go through the treatment protocols with medications, aerobic exercise, patient education, which is what we are working on providing you right now. But again, here they're looking usually in primary care or community settings. And again, we address that there's a gap in that education. So they're really deferring to the primary care physicians to be providing you the education that you need. And we know that that's a gap because primary care physicians have not been educated on fibromyalgia. And in the past history, we've hoped that they've kind of jumped in, but we really haven't geared medical education to primary care for a long time. Stress management, good sleep habits, cognitive behavioral therapy. I know for those of you who definitely stress nutrition, they don't really mention that, and it's not going to come up because there is a lack of research in nutrition, and so that's going to be an issue. And then again, it's like, how do you implement these lifestyle changes? I did like the fact that they had complications of fibromyalgia. So this really feels like it's kind of acknowledging something and quality of life for many of us. So more hospitalizations, lower quality of life, higher rates of major depression, higher death rates from suicide and injuries. So higher rates of other rheumatic conditions. I do like that they acknowledge this. How can I improve my quality of life? So yes, the goal here, according to everyone, is to get moving. And again, we'll address this in another video about, for those of us who struggle with movement and exercise and for many years could not get out of bed to do any of these activities. So again, it's geared through physical activity. Join a self-management education class and these programs. And these programs aren't necessarily, I'm going to be honest, aren't geared towards fibromyalgia in particular. They're more about arthritis when it comes to these things. So we've seen the American College of Rheumatology. I just want to point out that this National Institute of Arthritis and Musculoskeletal and Skin Diseases with the fibromyalgia definition, and I'm going to pull that up because these sites all link to that. And what's interesting there, as I think we're done with this information for the CDC, so you can see what's there and what they give, but we're listed under the arthritis types, which again can be confusing because, as you saw from the American College of Rheumatology, they definitely say it's not arthritis. But I'm going to go over to the other screen share that we are going to see here and add that in for you. I know it's a lot of jumping around, so we're trying something new here. Okay, so what is fibro? And here's the one that gets deferred to from all the sites. So the American College of Rheumatology had a link to this site. And this is, again, through the NIH. And this fibromyalgia information in depth, and they have some PDFs and those things. You can download those PDFs. But I would like to point out that this page was last reviewed July 2014. So I guess they just got stuck. And I think that's the problem, is a lot of information kind of got stuck in 2013 for fibromyalgia. It's like ramped up in 2010 with some of the new diagnosis criteria. And then from there, 2013, you got some information, but it kind of scattered after that. And it's really confusing as to what happened. And if anyone wants to share more information, if you have some insights on what's going on, I had severe brain fog during those times. So I kind of lost what was going on. I was just frustrated. So I definitely have even a gap in my mind of what happened in these times. But what is fibromyalgia? Long-lasting or chronic disorder that causes muscle pain and fatigue. That muscle pain thing can be really confusing, again, because we've stated it's from the other sites, how it's different. I am glad that it does have endometriosis in here, which is something else that many of us go through, and it needs better diagnostic tools. But just to note, fibromyalgia is a long-lasting or chronic disorder. So that's, again, across the board, that's become completely accurate for its, chronic. I do like some of these other ones that they have here, just to mention, and like TMJ. So all of these things need to be checked out. And again, I don't want to spend too much time because this hasn't been updated, but you can see if you came across this site and didn't pay attention to some of the updates, it's not so bad, but I think we're looking across the board from some more accurate information. And of course, there's other information out there about fibromyalgia tests as well, which aren't included here. And again, we would love people to come on board and talk about this, because what's the disagreement going on? I know we've heard from blood test issues. Is it just because they feel that there's some bias or it's not well researched? So it's definitely good to have all that information here. So that's what the NIH has as far as those go. Okay, now we're going to continue with Webmd. And again, oh, I forgot to put that link for you. So let me do that really quick. So this is the referral to the NIH. And just to point out, I think this has become an issue because of funding. Now, we get a lot of questions because whose house of the NIH does fibromyalgia fall under? Now, with the ACR calling it a neurologic condition, but we've been placed here, but CDC says it's arthritis, and the NIH for, this section has kind of not updated things. So whose house under the NIH do we fall under? And I think this is a confusing point, and this is something that we were getting across to our representatives when we were at Capitol Hill, saying we need this information to be accurately updated. And I think this is a point of understanding of where we belong and a possible reason why the budgets have decreased too much. And next Sunday, I'm going to be going through and showing you the actual research that's being funded from the NIH. Budgets have decreased, and I'm going to show you how we figured that out and what is getting funded. And we'll do the same thing, screen share for you, and you can follow along with us. So let me stop sharing this screen and move over to Webmd. I'm going to try to keep going here, and I want to keep it short. I hope I don't have to do a part 2, but you can see how this information, and then when you jump on social media, it gets even more confusing. So that's why I just wanted to share this information and just clarify that these sites all have different information. So it's no wonder we all are sharing different little pieces of what we assume is the correct information. And it gets, and I got diagnosed, and I didn't have this internet stuff because I was diagnosed in the 90s, but I appreciate that there's more information out there, but it is very confusing. So this is Webmd, and let me share this information with you with a link. And what I'll do is I'll summarize all of this in the description and add all the links with better information. But in case you want to follow along, here's the way you can do it. So Webmd, so fibromyalgia is the second most common chronic condition affecting your bones and muscle. Right there is just, and I was trying to see if they have any updates on this information. And again, this is just what you're going to end up reading from the information that's on the internet. So condition affecting your bones and muscles, which again, if you went to other sites, that is a very confusing point. I'm glad they point out it's often misdiagnosed and misunderstood. So they definitely address the joint pain, but again, we've seen that the joint pain needs to take a better look at, because you could be having joint pain for multiple reasons, especially if it's arthritic, if you have an autoimmune condition, underlying thyroid condition. So this is right here. This first straight out of the gate definition is very confusing. There is no cure, but a combination of medication, exercise, managing your stress, and healthy habits can ease your symptoms enough that you can live a normal and active life. Again, many of us will have comments regarding that for sure. Causes, doctors aren't sure what causes it, but some think it's a problem with how your brain and spinal cord process pain signals from your nerves. So this is good. At least they have some update that, again, we're looking more at the brain and research that's going on. And I am glad that there's new research on neuroinflammation, and they are talking about fibromyalgia as neuroinflammation. So that's helpful. We do consider certain things suggest you're more likely to get it. You're a woman. So again, I really wish that we could change some of the language from this. You have another painful disease such as arthritis or infection, mood disorder like anxiety or depression, physically or emotionally abused or have PTSD, rarely exercise, other family members have it. I definitely hope that WebMD, and maybe this is some pressure we can do as an organization on changing some of that language when it comes to these things. So they list some of the symptoms, low pain threshold or tender point. So we definitely have this in there, even though you don't have to have a tender point test. And again, I'm glad that they say it can feel similar to other conditions. So that's good to know. They've added other things, diagnosis. I do recommend that you get, and then again, I'm trying not to make recommendations, but I'm glad they have this in, blood tests to check your hormone levels and other signs of inflammation, as well as x-rays, so you can take a look at other conditions. Because it's important. I mean, I did a video not too long ago about inflammation and inflammation in fibromyalgia, and I'm not sure it's being measured. And then there's different research that is actually more accurate now with the CRP measurements, and I should get into that into a separate video and bring that back to talk about inflammation. So I think this is what you'll find from WebMD and treatment protocol. So they list the FDA-approved medications. So these 3 drugs are approved specifically for fibromyalgia. And that's where a lot of the providers will start. Of course, there's been more research recently on yoga, Tai Chi, Pilates, and walking. So that's predominantly where a lot of the research has been for fibromyalgia and treatments. We definitely need to diversify this. Again, if you're a nutritionist and you're not seeing any information on those lifestyle changes, that's something to definitely help us push for. Complementary therapies. So there has been research on massage, acupuncture, and chiropractic manipulation, management of stress. So these are important points. So I think it's interesting. Again, it's heavily about muscles and joints in there. So that is, again, what you would see from WebMD when it comes to what is fibromyalgia. And for this, just for this video, I am leaving out certain organizations because, again, we are a nonprofit organization, and this is not to, you know, call people out, like say, I figure with the government websites, this is okay. But how I'm trying to demonstrate here how confusing the information is to begin with. So if you are a new patient, newly diagnosed with fibromyalgia, if you're a caregiver looking up information for your loved one, or if you're a doctor doing research, this is very confusing information across the board, depending on what you come up with. And there are paid sites that run an advertisement on Google if you're searching through Google. And so they have even more information, and it's very different information. So with the basic definition, I would love for us as a community to just get the basic definitions down for what is fibromyalgia, just basic stuff so that we have a foundation to go off of. And then we can give that and educate that. And from there we can go and we can talk about things. And we can bring in our thoughts and we can bring in new research. So that's the goal of these videos. So if you've done a lot of research already through PubMed and all of that stuff, and you'd like to share that information with us, please be sure to send me a message. And like I said, I'd be happy to bring people on to these live streams so we can talk about things. Or if you are a person involved with the fibromyalgia blood tests and any other research related to fibromyalgia, we would love to hear from you. Okay, so let me remove this. And I'm going to go to the Mayo Clinic. So it was another one that popped up. And to be honest, I have their book. I have their new book about fibromyalgia, but I have not had a chance to read it. There was an interesting video by someone that works for them, And I was really impressed by what that doctor said. But some of the other videos, again, I get a little bit, it throws me off because it's just, they really pound into your brain, movement, 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 over and over again. And if you are familiar with my own story, I was bedbound. It was very difficult to move. It's very difficult to exercise still for me. I can move better than ever before, but I spent a lot of many days bedbound. So constantly hearing, you got to exercise, 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 is a tough one. And I think for many of us too, we struggle with that answer, and we're looking for other ways that we can manage our fibromyalgia. So here is this information, and here is the link. So you can follow along. And again, I will add all this information to the complete description so you can find what we have been going. And it's nice that you can request an appointment if you have. And some, people have really been helped by going to their clinics. And again, I have to do my due diligence and read their updated book. But I think what we need to do is maybe reach out to them and get some more information. And I'm very glad that they have some of this. So share on. I hope this is one. I hope this is not when it's updated. I definitely need to ask that because that's 2017. Their book has come out recently, so maybe I should do a comparison of the book and then reference what they have online. As a tech person, I get disappointed to see that the websites aren't updated as much as they should, because for me that seems like the easier path to do since everyone is doing online search. Okay, so let's dig into this one. Oh, Deborah, I'm sorry. So none of the links are working. Okay, well, I'll definitely put a description in the description. I'll add the links to the site. But if you were to search in Google and what is fibromyalgia, you'll see what I'm talking about. But at the end of this live video, I will definitely add proper links. I'm not sure why it's not working. So sorry about that. Okay, so fibromyalgia is a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. So musculoskeletal pain, which is a mouthful for many of us to say and even remember, is different terminology than what you've seen before. Researchers believe fibromyalgia amplifies painful sensations by affecting the way our brain processes pain signals. Again, at least we're talking about the brain and the brain health and what's happening in the brain. So this is good. This is good that we're going into that direction. Sometimes things begin after a physical trauma, surgery, infection, or significant psychological stress. So the diversification is here. It's interesting that they add, in other cases, symptoms gradually accumulate over time with no single triggering event. So again, a lot of this information I wish could just kind of combine or understand or put together or get some coalition together that we can revise all of this and suddenly get on one page. They're on board with women are more likely to develop it. And I forget from what Norman and the men with fibromyalgia have said statistically what the update is for how much of the percentage of men being diagnosed. I know it has increased quite a bit. So we'll go for many have fibromyalgia, tension headaches, TMJ disorders, irritable bowel syndrome, anxiety, and depression. While there's no cure for fibromyalgia, a variety of medications can help control symptoms. Exercise, relaxation, and stress reduction measures also may help. So that's been pretty consistent across the board. There's no cure. Medications, exercise, relaxation, stress reduction. You've seen sleep in different places. So they're addressing all of this. They're addressing the different symptoms of widespread pain and the diagnosis criteria and some other coexisting conditions that we see with fibromyalgia. So that acknowledgement is there. And all these links will take you to different articles, fibromyalgia or not, fibromyalgia linked to other health problems. You can request an appointment. They did put genetics there at the top, which is actually interesting. So we are seeing more of that because fibromyalgia tends to run in families. We do see in the lupus community, there is a lot of fibromyalgia running in families as well. So at least they're acknowledging the genetic mutations. Some of the genetic research that we've seen is about single SNPs, which gets complicated. I know it's hard with research to analyze a group of SNPs. So hopefully, I'm hoping that they can do some more things with that. I do like infections. Some illnesses appear to trigger or aggravate fibromyalgia. I would love for Lyme disease to get more headway in diagnosis so we can figure out some differences there with infections. I know MECFS is doing a lot more research on that, and I'm grateful for their research because of its connection with fibromyalgia, and they do address physical or emotional trauma there. Why does it hurt? This is kind of interesting. Research believes repeated nerve stimulation causes the brain of people with fibromyalgia to change. So there's a lot with that. Again, I'm just, happy that they're talking about the brain much more than they ever have in the past. So risk factors, family history, or sex. So, fibromyalgia is diagnosed more often in women than men. Other disorders, so they are addressing that. Complications. The pain and lack of sleep associated with fibromyalgia can interfere with your ability to function at home or on the job. The frustration of dealing with an often misunderstood condition can often result in depression and health-related anxiety. So I'm glad that they're acknowledging that. They have other related information on things, so fibromyalgia neurontin, cupping therapy. So I'm assuming they're going to put some of the, the research behind these articles as well on how they do it. So they have put together the press, so this new book, which came out in 2019 with the hope for fibromyalgia patients. And I will be sure to take a look at that book and review what they're saying with that information as we go along. So that's their guide with that. And you can kind of look around depending on what you feel is more accurate and go from there. But I am glad that they do here. I went to the blood tests. So they are looking at complete blood count. They're doing their due diligence to look at some other things. So the SED rate will show some inflammation. They have some other tests, rheumatoid factor, thyroid function tests. I'm really, really glad they put the thyroid function test. Now, I'm not sure if they're just running the TSH and maybe a T4 and not doing a full thyroid panel. That's a whole other conversation on making sure you rule out any underlying thyroid conditions. But they have their information here. So you can, as you can see, you can pick which website you prefer and kind of go from there. But it's definitely goes in different directions when it comes to that, which is why it's confusing to put out information. And I feel that even when we write content for the Support Fiber website, we need to cite where we got this information from and all these websites. But those are just some of the websites that pop up when you do a search for what is fibromyalgia. And there are many, many more, and there are differences in numbers. There's differences in the information, but I thought I would just give you a top level highlight so you can see that it can get confusing, and depending on which one you pick, this is why information can get and change and be different. And even from the diagnosis criteria, it's like newer guidelines don't require a tender point exam. Instead, a fibromyalgia diagnosis can be made if a person has had widespread pain for more than 3 months with no underlying medical condition that could cause the pain. We should get into a separate video of diagnostic criteria. We'll go through the updated versions from the 90s with the tender point and what they're saying now. And again, that was created by the American College of Rheumatology. So they've come up with a 2010 version. I have heard that there are updates, but it doesn't seem like it's widely accepted. So we can go through that information if people are interested as well, and what you know and what you feel. But I'm going to wrap it up with that. That's the overview of what you may see on the internet. Please send us messages. Please post us comments. If you like this video, share it with other people, like our page, and stay tuned for content. And I'm always looking for suggestions. This is going to be literal conversations. We're going to do screen shares and take you through the information. Next Sunday, I'm going to show the NIH-funded research for fibromyalgia. We're going to dive into what is being currently funded from the NIH and where we can go from there, because I want to give people accurate information so you can see it visibly, you can follow along. And if anyone has already done this research or has done research in general that wants to share with us and talk about what they see, please reach out. And again, we would love to have you on, or if you're associated with any of these organizations, we would love to have a conversation with you. I'm gonna go now and join the Dr. Terry Wall's virtual seminar. If anyone is on Instagram, I'll be doing a wrap up later today on the virtual seminar for everyone there. I'm excited to learn from information. So please stay tuned for more videos from the Support Fibromyalgia Network. I'm Melissa Tolwar, and I will actually see you next week. Bye.